We are very excited that you will be leading the medical practicum at CannMed 26 once again, along with Dr. Dustin Sulak and Dr. Ethan Russo. The practicum, it's always a highlight of the summit, and traditionally it's provided some excellent foundational information, including the endocannabinoid physiology, cannabis pharmacology, dosing, etc. But for next year, we're going beyond the basics. So I was hoping you could talk a little bit about the new format and what attendees can expect.
Yeah, it's really exciting. We decided to change it up just to delve deeper because we have a lot of research and a lot of clinical experience amongst the faculty that we want to share in just a deeper dive. And so we will be kind of revisiting the endocannabinoid system and some of the foundational pharmacology and um, other aspects of endocannabinoid system and the plant and how they interact, but in a very condensed way. I'm really excited because we have Dr. Russo joining us. And he was the pioneer who hypothesized the idea of the clinical endocannabinoid um, um, deficiency syndrome, about 20 years ago. And he is going to give a talk on that hypothesis and what we have discovered over the last 2 decades that support that hypothesis. So it's really exciting that he's going to be able to, and we're calling that clinical endocannabinoid deficiency revisited. So I'm really excited about that. We're going to focus too, and I'm going to give a talk on minor cannabinoids. This is a huge part of my medical practice. I have patients who are not using THC or CBD and are experiencing life-changing results. And that is like, when people might say, well, what are you even talking about? So CBDA, CBG, CBN, CBDV, and I probably have joked with you before, my husband calls it alphabet soup, but
Mhm.
these cannabinoids are non-impairing. They are incredibly beneficial for inflammation, neuroprotection, antioxidant, anti-seizure, anti-cancer. I mean, there's all of these cannabinoids have so many properties. We also have Dr. Dustin Sulak talking about chronic pain, and he's going to focus on clinical strategies for patient success in challenging cases. Really excited about that. We're going to go through the deep dive of cannabinoids in the immune system, which is a huge topic. I'm going to be doing that one. It's hard to cover in 45 minutes, but I'm going to give it my best. And then Dr. Russo again is going to cover neurology, including Alzheimer's and ALS. And remember, he's a neurologist by training, so it's a really nice perspective that he gives us. And then a couple other topics. We're going to cover sports and recovery, which is great. We're going to cover pregnancy and lactation.
Mhm.
We're going to cover cannabis and psychiatry because there's a lot of controversy there. It's not controversial to me, but it is in the medical community. And then we're also going to cover product formulations because we realize that when somebody is new to this, they
Yeah.
may not understand how these products are formulated, what the differences are in terms of base carrier oils, in terms of nano versus non-nano versus just even, how they're extracted. And so we feel that that's a really great way to go. And then for some fun stuff, we are including a pre-test and a post-test that we're going to ask participants to participate in. And by submitting those, people will be entered to win some fun giveaways. So we're really excited about the upcoming practicum. And I just think it's going to be a wonderful day of education and networking and, again, trying to expand really what we're seeing in clinical practice. So much more than just, I can't sleep or I'm anxious. There's just a whole slew of other topics that need to be included.
Yeah, no, we are Very excited. We always are. The practicum, like I said, it's always a highlight. And I think it's always, even though it's a full day practicum, it's always so hard to fit everything in. So I think it's great that we have this new approach, and we're going to be diving into some of the newer topics or some of the ones that haven't been covered before. But we're also going to make recordings of the previous practicum available to attendees too. So even if you are still new to cannabis, you can get that foundational information and come get the new information. And if you've come before to the practicum and are looking for something new, we have that for you as well. So I think it's going to
Yeah,
be
we
awesome.
got you covered. Yeah, we got you covered either way.
Excellent.